Almost every week, I see men who tell me almost the exact same story. They're more tired than they used to be, their workouts aren't producing the same results they did 10 years ago, they're putting on weight, especially around the waist, their sex drive isn't what it used to be. So they do what a lot of men are doing these days. They order one of those online testosterone tests, and a few days later, they get an email saying their testosterone is low, and almost immediately they get offered testosterone injections. Now, maybe testosterone is exactly what they need. I'm not against testosterone replacement at all, but almost nobody stops to ask the question, in my opinion, the one that matters the most. Why was your testosterone low in the first place? There's a massive lack of curiosity about this basic question, because replacing testosterone and figuring out why your body stopped making enough testosterone are two completely different things. So today, I want to walk you through how male hormone system actually works, where it can break down, and why looking at that one testosterone number never tells you the whole story. So if you're thinking about getting testosterone replacement, please watch this video in its entirety. Because even before we can even talk about testosterone, we need to understand how the system works. And your body isn't just randomly making hormones, right? It's constantly adjusting them. If you think about it like the thermostat in your house, right? If the temperature gets too high, then the furnace shuts off, right? But if the temperature gets too low, it turns back on. And your hormone system works almost exactly the same way. It's just one big feedback loop. So if you understand that feedback loop, everything else in this video is going to make a lot of sense. So let's start with this diagram. Up here is the hypothalamus. You can think of it like the control center. It sends signals to the pituitary gland, also in your brain. It's just sitting below it. Now the pituitary releases a hormone called LH, which is luteinizing hormone. Luteinizing hormone travels through the bloodstream to the testes, and the testes respond to luteinizing hormone by making testosterone. It's pretty straightforward so far. But this is the part that almost nobody explains. As testosterone levels rise, they send a signal back to the brain saying, we've got enough. You can stop asking for more. So the hypothalamus stops sending as much signal to the pituitary. The pituitary slows down its LH production, so LH goes down, which means now the testes don't make as much testosterone. Everything stays in balance. That's how the system is supposed to work. Now let's say your testosterone comes back low. And this is where, in my opinion, a lot of online tests stop asking questions. They just say, oh, your testosterone's low. They see that, and then they say, oh, you need to be on testosterone. So I know it's a silly analogy, but it's kind of like seeing the check engine light come on in your car and just replacing the engine before you've even opened the hood. The question shouldn't be, is my testosterone low? The question should be, why is my testosterone low? So let's start with the testes. Imagine they're not working very well. The pituitary senses that testosterone is low, so what is it going to do? It's going to start making more LH, right? More of that luteinizing hormone. It's basically yelling at the testes, come on, make more testosterone. But the testes can't respond. So now you have low testosterone and high luteinizing hormone, or high LH, and that is called primary hypogonadism. The problem is in the testes themselves. And in that situation, testosterone replacement may absolutely be the right treatment. But now let's look at a completely different situation, one that actually occurs 10 times as often as that one that we just mentioned, primary hypogonadism, where the testes aren't producing enough testosterone. In this new situation, what if the testes are actually perfectly healthy, but the pituitary isn't producing enough LH? The testes are basically sitting there waiting for instructions, but the pituitary never sends the signal. So the testes don't make as much testosterone. Not because they're broken, they're doing exactly what they're asked to do. And this is called secondary hypogonadism. Like I said, it occurs about 10 times as often, according to the research, as primary hypogonadism. So the question is, what causes secondary hypogonadism? Why would the pituitary stop producing enough LH? There's a lot of possibilities. Poor sleep, untreated sleep apnea, obesity, insulin resistance, chronic stress, certain medications, especially opioids, heavy alcohol use. Sometimes it's even just severe calorie restriction. Sometimes it's overtraining. And the important point isn't just memorizing this list. The important point is realizing that the testes may be completely normal. They're just responding to the signals that they're getting, or in this case, not getting. So I hope now you can start to see why I get so frustrated sometimes. If I don't know the LH level, I honestly don't know where the problem is. Is it in the brain or is it in the testes? And you're basically guessing. And that's why I almost always want to measure LH when I'm working with somebody with suspected low testosterone or confirmed low testosterone. Now, a high LH is going to tell me what? It's going to say the brain is asking for more testosterone. A low LH tells me the brain isn't sending the signal. And that's one of the biggest clues in this entire workup. And it's amazing how often it's not measured. Now, unfortunately, I don't want to complicate things more, but that's not the end of the story because testosterone doesn't just stay testosterone. So let's take a look at the hormone cascade. It all starts up here with cholesterol. Cholesterol gets converted to pregnenolone, pregnenolone to 17-hydroxypregnenolone. That gets converted to DHEA. That gets converted to androstenedione. Androstenedione gets converted to testosterone. And then once testosterone is made, it can go in several different directions. Some of it stays as testosterone, but some of it gets converted into estradiol, which is an estrogen. Some of it gets converted into DHT. And your body actually needs all three. I know a lot of guys don't like to hear of the word estrogen, but men need estrogen too. So the goal isn't to have no estrogen. The goal is to have the right amount. Now, the enzyme that converts testosterone to estradiol is called aromatase. And as body fat increases, aromatase activity increases too. So more testosterone gets converted into more estrogen. Now, imagine a clinic measures your testosterone, gives you testosterone injections, but never checks your estradiol levels. You may be converting a significant amount of that testosterone into estrogen, and neither you nor the clinic realizes that that's happening. So a lot of guys get testosterone injections, then they start getting gynecomastia, or what some men call man boobs, or they start getting emotional when they start watching movies because their estrogen levels are so high because they've been getting the testosterone injections and aromatase is converting it into estrogen. And that's why one of the many reasons why measuring testosterone by itself certainly doesn't tell the whole story. Now, testosterone can also be converted into DHT. It's a very potent androgen, or like male hormone. It's important, but elevated levels contribute to things like acne, accelerated male pattern hair loss, and prostate enlargement in susceptible men. Again, if you're just measuring testosterone, you're missing where that testosterone is actually going. Now, there's another lab that I want to mention. There's many others, but one other that I'll just mention right now is SHBG, sex hormone binding globulin. It's sort of like a transporter for testosterone. It binds it and makes it inactive. So you kind of think of sex hormone binding globulin like a taxi. Testosterone is riding around inside that taxi, and as a result, it's not doing much work. The testosterone can actually get out of the cab and interact with cells, and that's how your body uses it. That's called your free testosterone. And two men can have exactly the same total testosterone, but completely different levels of free testosterone levels, again, which is where the work is done. And why would that be? Well, their sex hormone binding globulin levels are different. And that's why I don't like making decisions just based on total testosterone. So now let's pretend we skip all of that. We don't test luteinizing hormone. We don't test sex hormone binding globulin. We don't test estrogen. We don't test DHT. There's no investigation. We just start injecting testosterone. So watch what happens. Testosterone levels rise. The hypothalamus sees plenty of testosterone, so it stops sending signals to the pituitary. The pituitary sees plenty of testosterone, and they assume that the work is done. So they stop sending signals. LH drops, FSH drops. gonadotropic releasing hormone drops. The testes slow down their own testosterone production. Testosterone production inside the testes falls dramatically. Sperm production decreases. The testes often shrink. None of that is surprising. It's exactly what we would expect with normal physiology. The thermostat, remember we talked about that earlier, the thermostat senses heat, so it shuts the furnace off. So I hope you understand, I'm not saying this is a reason to never take testosterone. I'm not saying that at all. Testosterone replacement can be a fantastic treatment for the right patient, but you should understand how the system works before deciding if you're just going to start injecting one of its hormones. So am I against testosterone replacement? Absolutely not. I've recommended it for many patients when I thought it was the right thing to do. But I think testosterone should come at the end of a diagnostic process, certainly not at the beginning. So please remember that your body is smart. It's usually not making mistakes. If your testosterone is low, there's often a reason for that. My job isn't to just recommend somebody replace the hormone. My job is to figure out why your body made that decision in the first place. And sometimes the answer really is testosterone replacement. But other times, most times, the answer is simply improving sleep, treating sleep apnea, reducing body fat, addressing insulin resistance, managing stress, or correcting something else that's interfering with the entire system. So if this video helps you ask better questions next time you look at your lab work, then I've accomplished what I set out to do. My goal is certainly not to convince you to take testosterone or not take testosterone. My goal is simply to help you understand how your body works so that you can make better decisions for your healthcare.